it's Kendra, and I'm going to be doing Concept Mapping 101. So we were asked to make a speech about something that we want to demonstrate on how to do. So I figured this would be the perfect opportunity to introduce concept mapping, since we're going over brainstorming and stuff like that. It's a form of mind mapping. So we use concept mapping for many different things, one of which is huge in nursing. We use the concept maps to create a care plan for our patients. You can also use them in business to do finance stuff if you're trying to plan out your financial future, different goals that you have, different things that you want to do if you want to buy a house or whatever it may be. Concept maps is a great way to do that. Organize your thoughts. So for this, we're going to do a nursing concept map. To begin, we have our subject. He's a 58-year-old male, and he has a spontaneous intracranial bleed. So this part here is kind of the main subject, kind of the center of that concept map. And then from there, we're going to look at a couple things just to kind of get us going. Since this is a nursing care plan, we're going to look at the pathophysiology of what is an intracranial bleed. It's going to be an accumulation of blood in the intracranial vault. So now what we're going to do, we walk into our room, we see our patient. What are the first things that we see when we walk into that room? This is going to be our assessments. We see the patient is in the bed. He has a trach. There are picture boards in the room, and the patient has a PEG tube. And now we're going to look at some things that, what could have caused this intracranial bleed that is not right on paper. We don't see it when we first look in the chart. So now you got to kind of get your critical thinking going. So we see, did the patient have hypertension? Uncontrolled hypertension can cause an intracranial bleed. Or is he on anticoagulant therapy? That could also cause an intracranial bleed. So these are the things we're going to try to investigate and see if we can find out. In the meantime, we're going to come up with 4 nursing diagnoses. And these 4 nursing diagnoses are going to be what we're going to use to try and improve our patient and get him ready for discharge. So to begin, our first one we have is impaired communication. Now, what's going to be underneath our main nursing diagnosis is going to be our evidence. How do we show that this patient is having this problem? So impaired communication, we can see that the patient does have a trach. That indeed does cause impaired communication. His speech is unclear. He is having frustration when he's trying to communicate, and he's unable to grip a pen. So not only can he not communicate verbally, but also written. He's having trouble. So now we're going to go down. We have ineffective coping. How do we see this? Well, he's getting frustrated when he communicates. He is in restraints and is combative. And he's also trying to remove his restraints. So if we come over to this side now, we have impaired cerebral tissue perfusion. This is evidenced by the patient did have an intracranial bleed. He is having trouble forming words. He is unable to walk, and he is incontinent. He is having trouble controlling his bowels and bladder. Now we get down here and we have self-care deficit. We see this when the patient is unable to communicate his needs. So even if he cannot do a task himself to help care for himself, he can't even communicate if he needs something done. He is lacking coordination. He would need coordination to bathe himself, brush his teeth, comb his hair, anything like that. And he can't bathe himself. So now we can go even further with this, and we can branch off of each of these. And just imagine, we have this huge thing. It's going to look like a big tree by the time we're done. And after this, we would branch off with our nursing interventions, okay? So we see all these things, but what are we going to do to make it better and get the patient ready to be discharged from the hospital? Because once they are admitted, the goal is discharge. So for your self-care deficit here, we can help bathe the patient. We can give the patient picture boards to help him point if he does need something done. If we come over here to ineffective coping, there's a couple different things that we can do. We can give the patient soft wrist restraints instead of a leather restraint. That might help calm him down a little bit. We can also, just like the other one, we can give him the picture boards. If his frustration is with communication and having trouble communicating, the fact that he is able to communicate might help him a little bit with the coping mechanism. We can also show him a couple different things. Just because he can't communicate doesn't mean he doesn't like to do the things that people normally like to do. For example, there is a TV in the room. We can turn it on for him and show him the different TV channels. Turn on some music if that will help soothe him a little bit. Just talk to the patient. Even though they can't talk back, they still would appreciate your time. So this is my little 101 on nursing concept mapping. I hope that you learned a little bit, and you could probably do one yourself now too. See you later.